recognize some of you, but if you put your name on your picture, that would really be awesome. Let's see. We'll go ahead and get started. I see some familiar faces. I see Susie and I see Robin's name. I don't see Robin and I don't get anybody else here. Let's see, who else do we have? All right. So what I would like to do is start out with introductory type of question. Some of you know I'm Jan Elich Monroe, and I'm a professor at Ithaca College. Been there for 28 years. And I actually will be retiring at the end of this year, August 15th, which is kind of awesome for me, I think. I decided to propose this presentation actually for the T20 conference because I have been involved quite a lot with interprofessional practice at Ithaca College. And as I visited with interns and as I talked to different clinicians that I know, not everybody's familiar with the word interprofessional. And so I would like to expose or share this information with you all, but I would also, I also intend for this to be a very interactive session. So I hope you're all ready to not sit here for an hour and a half, but to put on your thinking caps, have a pen and pencil handy. And we're going to just take a few little journeys, crossing certain pathways. But before we start, could we just go around and have each of you introduce yourself, tell me where you work, and why this session? And are you familiar with the terms interprofessional practice, education, and collaboration? So who wants to start? Oh, come on. Okay, thanks, Susie.
Sure. All right. So, hi, everyone. I'm Susie Coletti. I'm a NYSTRA past president from a while back. I work at the VA hospital in Albany, New York. And I love it. It's the best place. And interprofessional collaboration between two or more professions, so rec therapy and PT, or I had a group today at work that I co-facilitated with social work and psychiatry.
And Susie, do they use the words interprofessional or are they using interdisciplinary?
It depends who you talk to.
Okay.
Our psychologist uses interprofessional. Nursing staff, they always use interdisciplinary. And everyone else, it's either treatment team or, hey, I need all you people. So it's a mix.
Okay. All right. Who wants to go next? Oh, come on.
I nominate Marty.
Can you guys hear me okay?
There you go. Let's do it that way. You pass it to the next person.
Can everyone hear me okay? Sometimes my mic messes up.
It's
okay.
Good.
Yeah, I'm retired now, but when I was working, I worked in outpatient mental health, and I always worked on an interdisciplinary team. I was never in a recreation department for over 33 years, and we refer to it as interdisciplinary or the team.
Okay.
And I came here because the other session is a two-parter, and I couldn't go to it yesterday because I was presenting.
Okay. All right. Now you
so
can
I've heard
pass.
wonderful things about you, so that's why I'm glad I'm here.
Well, thank you. I appreciate that. Do you want to pass it?
You ready, Tasha? She's my new friend.
Hi, my name is Tasha Soto, and I'm actually a student at Kingsborough Community College for recreation therapy. I'll be graduating in a couple of weeks and moving on to Lehman, so I'm pretty excited about that. And as for where I work, I'm an activities worker at the Norwegian Christian Home in Brooklyn. So I plan activities for all of the assisted living and independent living residents there.
Great. Do you want to pass it?
I am going to pass it to Robin.
Okay, Robin.
Hi, can you all hear me?
We can hear you.
Okay, good. My name is Robin Gallagher. I work, you might have to remind me my questions that I have to answer. I work in a assisted and senior living community. In my past, not currently, but in my past, because we don't have really an interdisciplinary team currently per se. But I have in the past worked more, it's more called interdisciplinary, since I did work with Marty and we had that same interdisciplinary team that we called it.
Okay.
Am I missing a question that I'm supposed to answer?
No, that's good.
Okay.
But you
All right,
could
good.
pass it to somebody.
I'm gonna pass it to Jeremy.
Oh, let's hope I don't get thrown off again. Anyway, I'm Jeremy Cash. I'm sitting here in Brooklyn, New York. I'm semi-retired. I used to be the full-time therapeutic recreation instructor at St. Joseph's College, the Brooklyn campus. I am still adjuncting at Lehman and I adjuncted at Delphi. And as an instructor, I wouldn't, talk about interdisciplinary teams because we didn't necessarily, as an instructor, I didn't have that experience, but I taught people who wanted to be speech language pathologists. At Adelphi, I've taught people who are going to be physical educators. And so it was a matter of trying to see and expand on my notion of provision of services so that it would encompass their way of thinking. And so it would inform them, if that makes any sense. How would you convert the thinking? Does that make sense? I think it does.
Yeah. I think we'll address some of that. Do you want to pass it, Jeremy?
I can't see any, but I think I need to look at a side-by-side gallery view. I guess that's it. Let's see who hasn't spoken yet. Okay, Crystal Wood.
Can y'all hear me okay? We good? Okay, perfect. Well, I'm Crystal Wood. I work at Loretto for their PACE-CNY program in Syracuse, but I'm originally from Virginia Beach, Virginia. I've been here about 2 years. I am a member of an interdisciplinary team. That was a new one for me. It's been weird trying to navigate like how to actually work as a team. And this is my first ever TR job. I'm a little baby. So I'm glad that I got to start out with the team.
Great. Okay, do you want to try and pass it on? I think we have maybe 3 more people.
Who else?
Could-
What about?
How about Shaelin?
Yeah. Shaelin is.
Hi, can you hear me?
Yes. We can.
Hi. Phew. I work as a part of a treatment team at Hutchings Psychiatric Center in Syracuse. I've been there about 11 years. I came in a little late, so I'm not exactly sure if there were some other questions I'm supposed to answer.
Have
Or if that was it.
Have you worked on an interdisciplinary or interprofessional team?
Yes,
Okay.
yes.
And what did they call it?
Treatment team.
Okay. All right. Who is left? Our moderator, do you want to participate?
Oh, sure. Hi, I'm Dorothy. I currently am a lifestyle director for an independent living community. The majority of my career so far has been in like assisted living. So unfortunately, I've not had the privilege of serving on an interdisciplinary team, but I'm excited to learn more about it.
Okay, and is there anybody that hasn't spoken? Oh, how about Emily?
Hi, everybody. You can hear me okay?
Yeah,
So I currently work at a skilled nursing facility, and I am a part of the interdisciplinary treatment team that involves the residents' care plans, both for short-term and long-term. And I've worked on an interdisciplinary treatment team as long as I've been a CTRS. So I've been at my current job for about 3.5 years.
and they call it interdisciplinary.
They just call it treatment team.
Okay,
Yeah.
okay. And let's see, who else is left? I only get part of the grid here because I have my PowerPoint up. Anybody else? I guess not. Okay, so hopefully, I know there's a couple of you who haven't spoken, but I hope that you will feel comfortable to engage in the conversation as we go. One of my favorite things about doing presentations is the interaction with the folks that I'm participating with, because I will learn as much from you as you will learn from me, because you're all coming from different settings with different perspectives. And this concept of teamwork is not new. I mean, it started in the 60s. I think the Rusk Institute was one of the first organizations that really emphasized teamwork. The Pew Foundation has been advocating for it for years and years, as has the World Health Organization. But it has gone through many changes over time. And it started out utilizing multidisciplinary teams where you would have different disciplines working with particular clients, but they were all on their own pathway. They were all just traveling down their own discipline specific pathway. And that resulted in some issues, because a client, if you could imagine having a physical therapist, an occupational therapist, a recreation therapist, etc., and each of them coming in and asking the same questions, it would get old as a client, and it's a waste of time. And I think that's why Pew and the World Health Organization, as well as insurance payers, start thinking we're doing the same thing over and over again. So then they went to interdisciplinary, and in interdisciplinary, the client was in the middle, and all the disciplines worked together to come up with a common treatment plan for that particular client. And so it was a reduction in the use of resources. And so that within the last, I guess, 5 or so years, they start changing the language to interprofessional. And so I'm going to focus a little bit on that language now. I did listen to Kathy O'Keefe and Lynn Anderson's presentation. I'm not sure when it was, but I listened to it yesterday. And Kathy actually used the word transdisciplinary. And that is, do you all know what transdisciplinary is? Anybody? It's basically that you'll have one designated provider who is the best match of services for the particular client. So let's say we have a person who was recently injured, maybe paraplegic. One of the first people who would probably be working with them would be physical therapy to get their mobility back. That's not always true, but I'm going to use that as a story. And that physical therapist would then talk to the rest of the team members and say, okay, you recreational therapists, this is what we need you to do during your treatment sessions to help this client meet the treatment goals. And so the primary therapist would be training other disciplines how to do the work to help to progress the individual to meet their designated goals. So we're going to go through this quite a lot. My primary goal here in this session is to talk about the IPE, interprofessional education, collaboration, and practice movement, and why that's important. But mostly what I'm interested in doing is helping us as individuals look at ourselves and see how we could use our knowledge, skills, etc., as recreational therapists to advance our professions through involvement with interdisciplinary teams or interprofessional teams. Does that make sense to y'all? Okay. So I started talking about pathways. I get an email weekly from this place called the KORN, K-O-R-N Institute. And I picked up one yesterday morning and it said, PowerPoints are blasé. People don't like listening or looking at them or doing them anymore. So I have this in the back of my mind. And so I will provide you with the PowerPoint presentation for detail, but you're going to find me chatting a lot and asking you to chat back at me so that we could really learn something from each other instead of just looking at slides. Okay. So pathways, there's a lot of ways we could go about our personal and professional lives. And I chose these pictures because I think that they replicate, or not replicate, but they demonstrate different pathways that we could take. And there's probably 10 or 12 more. But there's direct pathways. This little walkway to the beach, it has some curves in it, but if you get off the pathway, you're off the pathway. And that's kind of a comfortable place to be, right? You have a destination, you know where you're going, and you know how you're going to get there. There's also forced choice pathways, and this could be where you might, come to a crossroads and have to make a decision. And in terms of this particular presentation, the decision might be, or the choice might be, am I going to be an active member of this interprofessional team, or am I going to continue on my own pathway? And what are the positive and negative benefits of doing one or the other of those choices? But you're forced, and whether you go along or whatever path you choose, there's going to be consequences. There's also multiple option pathways. This is personally my favorite, where you can see that you can get up that dirt pathway by climbing stairs, by going up the slope. You could climb the rocks. You could go any multiple ways to get where you're going. And I think truly when you are working with other disciplines, the truth of the matter is we have to be willing and open to address multiple pathways, to think about who we are trying to work with, what are their knowledge, what is their knowledge base, what are their skills, what are their scope of practice, and then how do I then fit my knowledge, skills, scope of practice into theirs for what goal? I mean, ultimately, what is our goal? Somebody scream out our goal. Is it to promote recreational therapy? No, it's to promote the well-being, the health of the client. I see Marty shaking his head. We are ultimately looking at the well-being of our clients. And so oftentimes when we get engaged in interprofessional work, we get into sometimes the poor me thing. They don't respect me. They don't understand me. How many of you have that issue? Well, we'll talk about that more later. Anyway, you know, it really takes some skill to become a positive team member, particularly if people do not understand who you are and what you're doing and how it impacts the people that we're working with. So we will spend some time really trying to think about that and pursue it. So do y'all have a piece of paper and a pencil? Something to write with? Good, good. So I'm gonna walk you through a little exercise here, and you don't have to share this with anybody. If you choose to share it, we could see if Dorothy could open the screen up for people to, you know, share their little notes, put it in front of the camera, whatever. But I want you to begin first and foremost by imagining yourself when you were in preschool. I shared this idea with a neighbor and she said, well, that's really hard to do. I don't remember myself in preschool. Some of us probably didn't even go to preschool. So let's say kindergarten. You know, think about you when you were, before you started formal school. And how would you have described yourself? Or how did people describe you? And who was your hero or mentor? And what was their traits? So I want you to just take a couple minutes thinking about this, and we're going to move through our lives a little bit. I do have meaning in my madness here. So this one's probably going to be the hardest. You know, I, for example, was viewed as a tomboy, daddy's little girl. That's my earliest memory. And I'm not going to share the rest of it because I want you to think about it yourself. So I'll give you, I don't know, 3 or 4 minutes, 3 minutes, 2 minutes. When I see people looking like they're done, I'll move on. And the thing I want you to most pay attention to as you're doing this exercise is to jot down those traits, your traits. What kind of person were you at this level? And what were the mentors that you had? What were they like? Are we ready to go to the next level? Give me a thumb or something. No, not yet. Okay. I see Tasha, looks like her thumb is up, or is that just holding her pen? Okay. Everybody else ready? Okay, good. So now we're going to move on a little bit. Elementary school, same questions. How would you describe yourself when you were in elementary school? How did others describe you? Who was your hero or mentor? And what were their traits? That's a big block of time, so it probably changed, but the first thing that comes to your brain. And when you're done, start throwing your thumb up at me so I could know when to move along. Dorothy, you don't look like you're having much fun.
They're having technical difficulties with the other session, so I'm just trying to help out
Okay.
with the correspondence. I apologize.
Well, that's all right, as long as you're where you need to be. We have some thumbs. How about high school? Did anything change? How did you describe yourself then? How did others describe you? Who was your hero? And what were their traits? All right, college, same questions. How would you have described yourself? How did others describe you? Who was your hero? What were their traits? How about your first job? How would you describe yourself in your first job? How did others describe you? Who was your hero or mentor? And what were their traits? And then some of you are only in your first job, but if you have a next job, go ahead and think of those same questions in your current position. And if you're retired or semi-retired, that could be an interesting thing to think about also. Somebody talking? Have a question? Please feel free to ask questions throughout. Zoom makes that a little difficult, but if you need to say something, please do. All right, so the next step is look at your descriptions and think about them. And were there any traits or characteristics that have remained with you throughout your life? Did the way other people perceive you change, and what may or may not have caused that? And have your heroes changed? And what do you look for now? Who's talking? So go ahead.
Oh, I know throughout some of the traits were the same all throughout. Like a friendly, outgoing, that was always there. But in certain parts of my life, I became tentative or anxious, and those were more pronounced. So I noticed that in terms of high school, which was some good and some suck. So, and college was a lot better. And work, when I started, was tentative. Retirement now, it's much more relaxed. And I don't think all throughout these periods, I don't think anyone knew about my anxieties because I kept them a secret.
Okay. Yeah, that
exists and still exists.
And that could really impact your work, even if you could hide them well. Anybody else want to share?
I'll go. Can you hear me okay?
Sure.
Okay. So I noticed that like when I was starting out in preschool, like I would put my parents down as my heroes. And then slowly as I gotten older, like my heroes had changed to like people that I could relate. So I put down Lindsay Sterling because like that's what I envisioned. And she also has a learning disability that I also have. So I feel like that's a pretty positive connection. And as far as traits go, I noticed that my kindness has always been there, my caring side, but I still had always been a little bit loner and quiet.
Okay. Anybody else interested in sharing?
Sure, I'll go.
Okay.
In kindergarten, I was happy-go-lucky. I was kind of my big brother's shadow. Everything he did, I wanted to do. And my hero was my grandmother. And then in elementary and junior high, I became more quiet and shy. And my hero was Dorothy Hamill. I wanted to be a figure skater just like her. And so I worked really hard and had a lot of fun with that. In high school, I became very nerdy in 9th grade, and then 10th and 11th grade, I was very goth. And my hero was some musicians of ill repute. And they really didn't have any positive traits.
Okay.
So nothing that I would look for now. And then in college, I found rec therapy and was really into the outdoors and also still really into academics. And I noticed my hero went back and was my grandmother again. In my first job, I was nervous, I was excited, I was, fresh out of school, and, I thought I knew everything, and at the same time, I knew absolutely nothing. And my hero was one of my patients. Her name was Beatrice, and she was an Auschwitz survivor. And she had dementia, and 3 o'clock was the worst time of day in the whole building. And then now in my current position, I don't know how I would describe myself. Kind of all over the board. I'm running from the 1st floor to the 9th floor, and I'm, in every program. But my hero, it's back to, family, my husband, my son.
Okay. So as an outsider, having seen you supervise students and work with them, I would consider you a very confident and knowledgeable individual. So that
Thank you, but you also send me the best students.
Okay. All right. So I'm going to go ahead and show you my pathway. Can you see that okay? The pictures there, they might be a little bit small, but this concept of pathways is actually somewhat of a stolen idea. I spent some time teaching in Finland, and one of the best teachers I have ever met in my life was a woman named Kaya. And the last session that I got to attend with her, she did a thing with pictures, and then she had us write our pathways. And I found it really interesting because sometimes we forget who we are and where we're coming from. And it's really, I think, really important to know what tools you have in your toolbox. And your personality, your characteristics, who you view as heroes, those are all things that really will fit into a toolbox that will enable you to make better connections as team members. Okay. You know, my pathway started out, I remember being daddy's little girl, a tomboy. When I was in elementary school, I went to Catholic school, and you know, the thing I was most proud of was I was a jacks champion. I don't even know if people play jacks anymore, but I have more holy cards than you could imagine, or I had, from winning jacks tournaments. And so that was one physical thing that I was really capable of. Catholic school didn't really focus on physical development. We were all about the spiritual. And so being able to play jacks was huge for me. When I got into junior high, I started working in journalism. And I guess Lois Lane and, you know, Superman, Clark Kent were my heroes at that point. But I acquired a real love for journalism, and that went into high school. And I had a professor, a teacher, David Robb, who he was a hard teacher. And we had a really kind of rough start where after I spent a lot of time writing an article, he stood up in front of class and tore it to little pieces. He said it was an excellent piece of work, but he would not put anything that elementary into his newspaper. It was on beadwork, you know, I was a little hippie in those days. And I didn't have much control in those days, and I literally called him an asshole in front of the whole class. And I got in trouble for that. But I got out of trouble because he told me to write an essay on the origin of four-letter words, and I did, but he wanted it to be 500 words. And I wrote one sentence, and it said, the origin of four-letter words aren't really bad. For example, a bitch is a female dog, and a dam is something that holds water back. And I gave it to him, and he called me back and said, this is not what I asked for. And I said, I learned my lesson. I'm not going to waste my time writing things that have no meaning. And I became his editor. So that kind of shows you what kind of person I was in high school. It was, you know, he really demanded good work, but he also recognized when somebody recognized that, well, who stood up to him. So then I got into college, and I was really interested in outdoor education, and recreation kind of just happened as an afterthought. In those days, I was backpacking, hiking, camping all the time. I spent a lot of time alone or with just a couple people on the Sangre de Cristos, doing a lot of outdoor stuff. My first job was at a state hospital as a recreation therapist. And there I felt really weird because all of the rec therapists there were PE teachers or coaches that kind of got grandfathered in. And I didn't really have training as a recreation therapist. I was a recreation major, and that was in the day that it didn't matter so much. But again, that kind of attitude of mine of, well, I need to get what I need, this doesn't seem right, surfaced. And I listened to Carol Peterson speak and ended up going to get my graduate degree at the University of Illinois and having her as my advisor. Some of you probably don't even know who Carol Peterson is. I'm getting old, I think. Yeah, I know. Then I became an educator and a mother. And this is really, actually, my interprofessional work started when I was at the state hospital. There was an occupational therapist there who, Terry Schlebach, she was just really willing to work together. And it was probably the best example of interprofessional work because we sat down and she said, these are the things I do well. And I sat down and said, these are the things that I do well. And we created programs where we co-treated or whatever for the most part, and we're able to do things that other therapists weren't doing. Most of the therapists just spent the time in the gym playing basketball. But we went on backpacking trips and we did a lot of outings, and it was a really, really great collaboration. And it happened very easily with her because we both knew that together we could do better. Then I got to Ithaca College, and this was difficult. And this is where I really had to put my that attitude in high school back on the forefront, because Ithaca College is physical, occupational, speech therapies, and recreational therapy. We also have things like athletic training and health policy services. And yeah, those are the primary ones that would, oh, and health and physical education, nutrition, etc. And I found that there was very little recognition from the broader base of people of what recreation therapists were. We do have a Center for Life Skills, and that is an interdisciplinary learning lab for our students. And within that framework, the recognition was there and it was pretty strong. But in terms of the global work with faculty, I really had to be assertive. And I think that that's why I wanted you to kind of do this exercise about what are your traits and what could you use. I would sit at a table and listen to them talk about events they were planning that were interprofessional, and they weren't including us, recreation therapy. And so I just, hey, well, what about recreational therapy? And if I said that once, I said that 15,000 times, and became more recognized and more involved in the IP projects, but never really felt like I had the same credibility as the PTs. Okay, so some of the PTs. So, you know, it takes work I think I've lost my mouse. It takes work to develop relationships, and it takes time to think about what is the best strategy to engage people and to help them recognize who you are as a recreational therapist and how you can contribute to the overall health and well-being of the participants that we're working with. And I think sometimes, and I'm not saying this to be critical, this is an observation and you could beg to differ with me, but I think sometimes other disciplines get in a track of doing what they need to do to get their hours, their contact hours, their reimbursement, their 15 minutes, whatever it is. And they forget that the real goal is quality of life. At IC, we have a lot of interprofessional events. One of them is where we get all the students together to do a case. We take a stroke survivor and we have each of the disciplines review the stroke survivors' history. We bring in speakers who are stroke survivors who can, well, I see a lot of people are chatting and I'm not following that. Susie, can you follow the chat and tell me if there's any questions? Would you mind?
Sure, no problem.
Okay, because it's hard for me to do all this at once. So anyway, you know, it's a really great project, but you know, it took a lot for me to come to the table. And then I'm sitting here saying, hey, on an interdisciplinary team, an interprofessional team, health policy is really important for all of the students to understand. How does administration work? And then other things like nutrition. Nutrition is a significant part of who and what we are, and could really complement the well-being of the client. And so it took constant reminding and sometimes fighting to get, not fighting, you know, physically, but being very assertive to get people to understand who and what we are. So the question is, do you feel like you're a valued member of an interdisciplinary team? Okay, I just went through the chat and there's mostly, okay. So, anybody? How many of you are positive members of an interdisciplinary team? Let me see your finger, your thumbs. Okay, I'm seeing part of you. Let me see the other half. Positive in the middle. Okay, so those of you who do not feel like you are on a good team, what do you think the problems are? What interferes with your ability to be a good team member? Anybody that said either sideways or otherwise, what interferes with it, with your ability? All right, so maybe we'll have you have some more pointed questions. Again, this is a paper and pencil exercise. When was the first time you worked with someone from a different profession? Did you initiate the collaboration?
Jan.
Yeah.
I'll talk, like, you know, and it's not currently, but like in the past, like of working in an interdisciplinary team, that there isn't that respect, I guess, in a sense, for what you do, like our profession, like that is what I have run into before, of like not having the other therapies actually see what we do and how we do it, you know what I mean? So that collaboration of really like working, like you said, like you have to really like, you know, kind of be a pain in the butt, I guess, a little bit to the other departments in therapy, like, because that, you know, once you start like working with them, that they will kind of get into it, but it is work. Like, you know, I have like run into like times where it's not, you know, a lot of times they're not willing to work together. But it definitely is better that you work together, you know, so
You know,
does that answer your question?
It does. And I think that, you know, it's something that I have found, like, okay, so I mentioned PT. There are a couple of physical therapists that I've worked with at the Center for Life Skills who are phenomenal. You know, they really understand who we are and what we do. In fact, they want to use a lot of our modalities. I don't know, but sometimes it would make me nervous, you know, because all of a sudden they're doing similar things. But we do a lot of co-treatments and we do them for different reasons, you know, in many ways. And if we could understand that, that, okay, I get it. You want to play balloon volleyball to get, you know, people standing balance in order. An OT might want it to do that to deal with the upper extremities. I want to do it so that people could have quality of life, so that they could know now that their extremities are working, they could use them in things they like to do, and they could have better self-esteem. They could have better relationships with others. They could try new things, take more risks because they're more comfortable with that. So I think people understand that is really important. The other thing that I found, especially at the Center for Life Skills, was I worked in mental health before I became an educator, and I knew very little about stroke rehabilitation. And I had to be pretty vulnerable. I would ask what may appear to be silly questions, like, why is that happening for that person? What's going on, neurologically? What's going on physiologically? And I did that because I thought it was, it was good for me because I learned a lot. And the other thing it did was it showed the other professionals that I valued their knowledge. And then once I figured out what they were doing and why they were doing that, then we could have the conversation of, okay, so how could I contribute to make this a more effective outcome for the client? And I like that language. How could we work best for the client? And I also felt it was very powerful for the students to have a faculty member say, I don't know the answer to that. Mindy, OT, knows all about hands. She could answer these questions. Let's go ask her. And then I would be learning while the students were learning, and then we'd figure out ways that we could make it work. But vulnerability is really a humongous part of, is that a word? It's a huge part of collaboration because you have to put yourself out there. And a lot of disciplines aren't trained to do that. They are trained in their scope of practice, as we are in many ways. But the more you learn about other disciplines, the more you realize that we're all doing basically the same thing, but we're doing it from a slightly different approach. And if you get the right mix, our clients are going to definitely benefit from all of that.
Hey, Jan,
So, yeah. Go ahead, Suze.
can I jump in with something?
Absolutely.
It's something about when the recreation therapists approach another discipline and ask a question about, well, why are you doing that? Or why does this happen, when this modality is used, or whatever the question is, it really doesn't matter. Something I found is that it gives that, say, the physical therapist or the speech therapist, it gives them the awareness that, oh, that rec therapist actually knows something about the anatomy, the physiology, about what's happening here.
Right.
And they also know enough to ask to learn more about it.
Right.
And so that is one huge way that at least at the VA that I've gotten to really find my niche and earn the respect of other professionals. And so that a lot of times on our treatment team, they'll come to me. They won't go to PT, they won't go to OT, they won't go to speech. They'll come to rec therapy.
And Suze, why is that?
What was that, Jan?
Why? Why do you think they're coming to you?
A couple of reasons. One, they know that the patient always comes first. When it's, with me, the veteran always comes first. Mm-hmm. And secondly, I'm a little bit of a pain in the butt, and I'm not going to stop until we get it done. So, whatever the job is, if it means that I have to ask why, 7 times, I will. So
I think there's a reason that I learned clinically when I worked in mental health. When we work with our clients, we're working with them in a naturalistic setting. We're doing things with them that are more normal, everyday, routine kinds of activities. We're playing games. We're doing newspapers, we're doing crafts, we're reminiscing, we're doing yoga and physical activities. And you see behaviors that you don't see if you're sitting in a room being talked to. I see some thumbs up here. I think one of the most significant examples of this was when I worked in private psychiatric in Virginia. We had a doctor who was very rigid, very Freudian, you know, he didn't believe that recreational therapy had anything except diversion. And we like to do family therapy groups, and he really didn't think we had the training to do that. So one day I had a really great staff. I had a lot of staff. I actually had like 5 people working with me. And so we asked them if we could have a family fun night. And the rest of the therapists and I sat down, we identified specific children and families that we were going to observe. We picked activities that were fun, but that would elicit some behaviors that we thought probably went on behind the scenes in the family households, like that balloon popping game. You put the balloon on somebody's ankle and you run around popping it. And I told my staff, I said, you need to observe carefully and jot down every note of what you observed. But this doctor said, you could do this, but you can't do any intervention. You could just play games. I said, fine. So we did this, and wow, did we get some great behaviors? Not necessarily great, but we had a mother slap a kid. We had parents fussing at the kids. There was some aggression. There was some isolation. And so we went to the team and we told the doctor about these observations. And he said, how'd you figure that out? And it's like, we observed them in a naturalistic setting. And these behaviors are just common. He ended up allowing us to run our own family leisure groups, our family groups, and then he would give us like 30 minutes of team time to report on our observations. And I think that's something we forget as recreational therapists, is that we have a modality that enables people to try skills that they're going to use in everyday living, that they're going to be able to use with their family members. They're going to be able to try those skills without that sense of failure, because everybody loses at a game, you know, and it's okay. And then you just learn how to do it better. And I think that's, to me, that's one of the most powerful things as recreational therapists that we do, is that we are able to see behaviors that other disciplines have difficulty seeing because they don't work in a naturalistic setting. So, you know, that was just another example of how do you get a physician to believe in who you are and what you do. And it's by recognizing the power of who we are and what we do and reporting it. I had another physician who said to me in a team meeting, Jan, why do you feel that's important? And I try to emphasize that to my students all the time, because oftentimes, because we're doing fun and exciting things, we report on things that are fun and exciting. And it doesn't always go back to the treatment team. So to gain credibility, you have to make sure if you're telling those stories, they're interlocking with the goals of that client and how you are helping that client accomplish those team goals. And, you know, I always think about that before I report. Why is this important as it relates to the growth and development of those individuals? So does anybody else see hints as to how you could enhance professional engagement, interprofessional engagement? Any
Well,
success? Go
I
ahead.
this is Jeremy here. I started teaching at Adelphi University on Long Island. They don't have a recreation major, and I did quality assurance at Kingsborough, and I met the PE, the head of PE at Adelphi, and they were looking to do a class on inclusion, and so I was asked to go out and teach there. But the most powerful thing that happened was that the students that I had were in a program where they have at Adelphi, they have freshmen who come in, a whole uh, cohort of freshmen who are on the spectrum. And so my students would meet after my class, and there's a strong point in my students would meet after class. After I was technically done, I could have come back to Brooklyn on the train, but they would meet with these kids and they would play basketball. But instead of me leaving, I stayed on and I watched. And you know, the PE professor was there, and I got in and I made suggestions, like a simple one. A guy is trying to teach one of the kids to do foul shooting. And one of the things that I did, I think was powerful, was I was very humble. I know nothing about basketball, so I would be learning from them at the same time. And the guy is standing there and he's shooting the basket by himself. And then I just simply said, I think it would work if you were holding a basketball and you gave the person you're instructing a basketball at the same time, and that the person would learn how to make the foul shoot, because they would be doing the movement with you at the same time, and it worked. And like the whole gym stopped in just that moment, because a simple thing that I said, which was, any one of us would have come up with, actually worked. But also that one of the things that we have to do is be willing to stay. I stayed 3 extra hours to do this. If I want to be taken seriously as part of that team, then I don't just say my time's up, I'm going home. That story is helpful.
Yeah, I think that interprofessional work does take more time until you get going. But then it still takes more time, actually, because, I have a colleague who I worked at the Center for Life Skills with, who is a speech therapist. And she recently retired and moved to Las Vegas. But we decided to do an international session together on professionalism and student stress and stuff like that. And, this is the interesting thing about interprofessional work, because I am this person who, I get these big ideas and I float them around and I get all excited and forget the details, right? I mean, I'll get it done, but I really don't care that much about the details. I feel they'll fall into place. Well, Susan, on the other hand, is incredibly detail oriented. And when we worked as co-therapists, sometimes it was a problem, because working with students, I think it's really important to have the opportunity to fail, not to hurt a client or to do damage, but if they're planning an activity and they have missed a step and it's not going to really ruin anything, I let them miss the step. Mm-hmm. Because then you learn more. You learn that, oh, I should think this through a wee bit better. And Susan couldn't do that. She'd make sure the papers were in the exact order and the pencils were right there and blah, da, 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 da. So it's like we're very, very different personalities, and things like that could kind of make you crazy. Like, Susan, I'm doing this for a reason, and she's saying, well, Jan, I'm doing this for a reason. So there's that need to be able to say, what Susan does for me is she helps me stay on track and to think things through more carefully. And she's also very researchy, so she makes sure that what we do is very outcomes oriented and well documented. What I do for Susan is enable her to be a little bit freer and to deal with mental health issues more comfortably, and to do more spontaneous interaction and socialization in groups. If if you looked at us in a room, you would never put us together as co-therapists. And there are times when it's difficult, where I'm just like, please stop. But she's invaluable to me. I've learned a lot. So if you're willing to give up some of those traits and characteristics that you have, to gain some kind of balance from the people you're working with, it's a really, really powerful experience. And she's in Las Vegas and I'm in New York, and we still agree to do sessions together. And I know it's going to take me longer. And I know we're going to have endless discussions on minutia that I don't really even care about. But I also know that it's going to be an excellent session because of that minutia, that ability to see how this is going to interface. So being able to be vulnerable, being able to think that your way is not the only right way is really essential. So we're kind of coming close to the end here. So I promised you I would talk about interprofessional education, care, collaboration, and practice. And I've had the luxury of being able to attend a couple of conferences that were put out by, shoot, I'm going to lose my brain here for a minute. There's a Center for Interprofessional Education in Canada. This is one of the, it's called, I don't know, EHPIC.
Educating health professionals
In interprofessional care. And they're based out of Canada. And when I share this PowerPoint with you, there's a reference list. And when we get to that slide, I'll show you. But these people have been doing this thing with interprofessional work for years. And they are slick, but they're also really good educators. And what they did was they took lots of information from like the World Health Organization, the Pew Foundation, as well as tons and tons of research over years to come up with this model, if you will. And when we get to references, I encourage you to spend some time going over their website. But I've been to 2 of their workshops. One was 3 days in Washington, and the other one was 2 days in the college, and I learned a lot. But basically, the World Health Organization defines interprofessional education, collaboration, and practice as multiple team members from different professions, providing comprehensive health services by working with families, family cares, and communities to deliver the highest quality of care across settings. I mean, Susie, you said this at the very beginning. Your definition was almost spot on. The thing that I like about the model that they propose is it's very client-centered and focused. And they ask that question that my doctor used to ask me, why is this important and how would it enable the client to reach their goals? Also, they emphasize the importance of not being so tied to your discipline that you feel that you have to work with everybody. Not all people need PT, not all people need rec therapy, not all people need occupational therapy. So finding the best mix of services is one of their goals. So I like this little labyrinth with all the clinicians in the middle, thinking of the pathways. We all could take very different pathways to get to that center, which is quality of care, for the clients, based not only on what we think they need, but what they think they need. Very often, I think as clinicians, we forget to ask the client what they need. There was a funny story I heard years ago. I think it was actually a journal piece, where there was a woman in a nursing home who would appear in the hallway on a regular basis naked. And she drove everybody a little bit, you know, like, well, what's going on here? Why won't this lady keep her clothes on? And finally, someone had the wherewithal to ask her, and her response was, the clothes are itchy. I can't, they irritate my skin. How simple is that? Another one was a PT working with an individual on getting up off of the floor. And the client was non-compliant, didn't want to do it. Finally, the PT said, why won't you do this? He said, I don't care about getting off the floor. I want to get into my car. I want to be able to transfer in and out of my car. So if we pay attention to our clients and meet their need, getting in and out of the car first, then they're going to say, hey, this therapist recognizes me as an important person and recognizes what my needs are and not just their needs in therapy. And that you got them hooked. I always feel like rec therapy is like a sneaky profession. We kind of throw a fishing line out there with some bait on it, trying to get people interested in something, then we reel them in. And once we reel them in, then we could do pretty much anything we want with them because they trust us. They know that we're concerned about their well-being and their quality of life. You know, stroke survivors may never be able to use their left or right side again. And that's a sad scenario, but we could teach them or help them figure out how they could still have quality of life, even though part of their body is not working. And that's the magic of recreational therapy, in my opinion. So if you look at the three, IP education, IP collaboration, IP practice, I think that they're self-explanatory. Educators should be concerned about providing students with opportunities to work with other disciplines while they're in the school system, while they're getting their college degrees. This does not happen very often in a formal manner. However, accreditation bodies, ours is behind in this, accreditation bodies for physical, occupational, and speech therapy all are requiring that there be an interprofessional education piece in the curriculum for the students. And if they don't have it, they don't meet an accreditation standard. I don't believe we have anything like that in our standards of practice or in our accreditation standards. I think we mentioned teamwork, but it's not as high on the continuum. So that could be another way that we could get credibility. Honestly, I don't know that it works very well because what ends up happening is they create an event that they could check off. Oh, we met this standard. And to me, that's not the real world, but anyway. So then IP collaboration, that's when people collaborate to come up with some kind of plan. So the Center for Life Skills at Ithaca College was an interprofessional collaboration. We had a group of people, PTOT, speech TR, we were an internship coordinators committee. And we would talk about internships, but then we would talk about problems and successes that we had with our students when they went out. And through this discussion / collaboration, decided that we should start an interdisciplinary learning lab for our students. Now it's an interprofessional learning lab because language has changed. I don't know if the models really have. And then practice is what you do out there every day, you know, where you're practicing with other professionals in a clinical or community-based setting. The practice domains presented by EHIPC. How do you say that? EPIC. They take interdisciplinary work a little bit further by emphasizing the importance of disciplines understanding each other's roles and responsibilities. That was part of the interdisciplinary model. But they go a little bit further and talk about values and ethics so that we are comfortable with knowing and understanding the values and the ethics of all of the disciplines, and that we practice those. You know, oftentimes when my students are working with other disciplines, they'll come to me and they'll say, with one of the other disciplines. They don't listen to me, they don't understand me, I don't know, like the way they're doing things. And, you know, my response back to them is always, have you talked to them about that? Have you tried to resolve that problem? Go back and try to fix it. If you can't fix it by communicating, then we'll have a joint meeting. My values are that we can get along. We can be active and productive team members, but it requires communication. It requires listening. It requires non-judgment. And I think we're probably one of the worst professions in terms of self-judgment. Oh, they don't understand us. We got to get out of that frame of mind and say, okay, if they don't understand it, it's my job to teach them, and to get out there and really bootstrap and do some work educating people. So values and ethics, roles and responsibilities, communication, teams and teamwork. And then they present this concept of the quadruple aim of interprofessional work. And it used to be the triple aim, where they focused on better outcomes, lower cost, and enhancing the client's experience. But they recently changed it to the quadruple aim because they decided, as we all should, that if the care team doesn't have a sense of well-being and joy, we're not going to be able to provide interventions or programs that help our clients achieve a sense of well-being and joy. So the focus of, you know, those 4 characteristics: teamwork, roles and responsibilities, communication, values and ethics, are really focused on, of course, cost. Everything in our world is money oriented, unfortunately, but also the client experience and the clinician experience. So if you go through any training with the EPIC, they really try to hone in on who you are as a clinician and how you could bring joy to yourself and those that you are working with. Isn't that a neat concept? It's and it was pre-COVID, which is kind of even cooler yet. So I thought to myself, are we trained to be good team members and collaborators? Well, what do you think? Are we? Do we have the knowledge, skills, and ability? Of course. Any curriculum that you go through, you're going to learn about leadership. What is teamwork but leadership? I hope we're all having client-centered intervention planning beat into our head until we're green. And if we're not doing it, and if we're not helping our clients understand why, that's the other thing that we need to do. Okay, I'm going to go backwards a minute. One of the things that I think diminishes our credibility when we're working with clients and other professions is we don't delineate with the participants what we're doing and why. So when I'm working with my students at like the Center for Life Skills, I am constantly encouraging them to say, these are the goals of this program. And at the end of the program, asking the participants, hey, did we accomplish these goals? What could we have done differently? What would you like to do in the future? And those simple questions, number one, engage the client, but number two, help the other professions and the participants understand that we're not just playing bingo. I probably shouldn't use bingo, but you know what I mean. There's hand-eye, there's visual discrimination, there's hearing, there's sight. There's so many things involved in that game. But we don't tell our participants that, and so they don't understand what's going on. We know about goal setting. We know about communicating with others. We know about assessment, evaluation, and skill development in the social realm. And we have standards of practice. So we are trained, but somehow we're reluctant. We're a little bit reluctant to strut our stuff. And I think that's what we really need to do, is to be confident enough in the power of recreational therapy that I almost want to say that we're in their faces, that we're constantly helping people understand the value and the worth of who we are and what we do. And if we hit a barrier, we have a stroke survivor group that had to go on hold because of COVID. And I was engaged with that group. It met once a month, and it was just for survivors to come together and chit chat with one another. And we did some education. I was involved from the get-go, and all of a sudden there's a string of emails coming across about taking the data from that, the outcome data from that survivors group, and doing a publication. And as I looked through the string, I realized, or one of them said, "Gee, Jen, we're sorry we didn't include you at the beginning of this conversation." And okay, so that could really annoy me, right? But it didn't. I just, I looked at the string of emails and I thought, okay, I know who this one is coming from. And then I thought about what they were trying to do. They were trying to get a literature review and introduction to this publication. And we've done posters at conferences. So I just emailed very gently, "Hey, why don't we look at the posters and the presentations we've done in the past? And we're going to have the lit review from that." Oh, what a great idea. So I never said, "Why did you leave me off?" But I looked through their work and found something that was missing, and I put it forward to them. And it came back as, "Oh, that's a good idea." So enhancing credibility a little bit by showing them that you're thinking, beyond fun and games, I guess. I don't know. But it's really important not to get mad. I mean, you could get mad, but channel it in a proper way to show you that you're okay. So what can we do to get more involved and recognized? And I've pretty much said most of these things, but use this movement, this IPEC and P movement to get engaged. And or if it's interdisciplinary still in your organization, use it. Approach another therapist and say, "Hey, I noticed that you have this really great skill. I'm not so hot at that, but this is a skill I could bring to the table. Why don't we do something together? Why don't we create a program where we could use our best skills together?" Or, "Hey, I'm thinking about doing this survivor group, but I think we need people from these other disciplines to make it meaningful to the client." Step out and see if you could do it. A little bit more work, yes, but benefits are endless. Oh, that's a Nystra theme, isn't it? Or who said that? Was it Nystra, NTRS? Somebody said
It was NTRS.
Okay. Then sit at the table with decision makers. This is one more thing to put on your plate, but I have found in my time, particularly at IC, the more engaged I got with the people who made the decisions on leadership teams and such, the more I was able to advocate for and promote recreational therapy and meaning and well-being. I guess I have to maybe take that back a little bit, because some of you may or may not know, but the IC program has been scheduled for elimination. And so I guess I didn't sit at the table long enough or hard enough, but in a couple of years, there'll be no more recreational therapy or outdoor adventure leadership at IC. But I tried really hard, and I kept it alive for many years when the threat was always there. Significant downsizing. We weren't the only program, but small numbers, things like that. I already talked about demonstrating your value and your skills, being a bit intrusive. Ask for involvement, but then once you ask for involvement, be willing to perform, stretch your stuff. Also, our consumers are our greatest advocate. I think, we see this often, that maybe right away they don't understand how important we are, but pretty soon they do. And sometimes it might take them after they're discharged from our program to understand how important it is. But they could be our greatest support, and should use their voices. And then developing personal relationships with therapists from other professions. If you know someone as an individual and as a person, they're going to be more willing to listen to you. So don't only sit with the RTs at lunch, invite a PT to lunch, invite a OT to lunch, go from there. And then I guess, does anybody have any other ideas you could share?
Dan, something that recently came up at work is we have these action requireds that have to get tracked, and nobody wants to do it. And it's for not just phys med and rehab, but for all of diagnostics and therapeutics. So it's PM&R, it's interventional radiology, and a couple other areas, and nobody wants to do it. And so I said, sure, why not? I'll do it. And so, it's just one thing that I can do that, nobody else wants it. And then all of a sudden, everybody needs the information on a daily basis so that they can get all of their notes corrected and get their, basically for reimbursement. And so that the rec therapist kind of has them all at her fingertips. They're all coming to me, and it's, oh, wait, you know how to do that? Yeah. So.
And then hopefully that you'll be able to show them that it's not so difficult, and then you get it off your plate and send them back to them.
Yes. And that's actually the plan. I'm training one of the speech therapists how to do it.
Right. Yeah.
So.
And that's the part is, we don't want to be the one who is going to take up all the jobs that nobody else wants. But we could be the one who could figure out how that job could be made more easier to do, and not so threatening. And I think that's really, really important.
Yeah.
Does anybody else have any ideas they'd like to share?
In the chat, Leah said, create a fun day that involves different treatment departments.
Leah, do you want to talk about that a little more?
Sure. Sorry, I was on mute. When I worked at a nursing facility, we had, like the nurses' aides be part of a fun day. I think it was Nursing Home Week. And it was fun to have the aides doing things with the residents. And, of course, the nurses could only be away so long. So that was kind of fun. Or having like the therapy team, like decorate the room at Christmas. And so each different part of the building had a theme. So it just involved more people. It made the residents get out and kind of see different things. And talk to different departments and things like that. So that was kind of fun. And you can make it therapy based if you need to, you know, depending on where your setting is.
Okay, good. Anybody else? Go ahead, Marty.
I remember, for those folks in mental health, I know a lot of folks have heard of RAP plans, the Wellness Recovery Action Plans. Well, we
Yep.
never had a group on it, so no one was doing it, so I stepped up and taught myself how to do the group. So that way, I think when you do something new that no one has ever done in the program, and they see, oh, the rec therapist is doing that, you know, when we show our expertise in the disability group, in addition to group process and goal setting, people take notice that, gee, they are equal team members and they're smart and they know the people. And then when we do a group like that, we can weave the TR principles into the group as well. And it's a win-win.
That's true.
Yeah.
Anybody else?
I think we can start off real simple by just greeting people in the morning as they pass us, because I just started in this field and there have been many times where nurses and nurses' aides will just walk right past me. And my mother taught me to say good morning to everyone. And this comes also from my past experience as a hotel receptionist, where I just said good morning to everyone. So I think we can start off small with being really curious and really involved with the person behind the position. So that way they feel that we care about the work, the quality of work that they're doing, and get them caring about what we're doing. Again, it's a collaborative relationship. We're here for the client, and we should be able to just use our best gifts to serve that client together.
Yeah, Tasha, I think that's really a great idea. When I was supervising several people in private mental health, I would tell my staff, the time you spend at the copy machine and the water fountain is almost more important than anything else you do, because you're establishing those personal relationships. And, you know, it's that kind of that black box effect. If people don't know who you are and what you do, they're going to be afraid of you, or they're not going to want to approach you. But if you're a friendly, kind person, then, and you show interest in them, sometimes people don't show interest in other people. They get so wrapped up in their job, they just don't go there. So that's I think a little bit problematic. We're getting close to the end. I do want to just I'm going to share my screen one more time. Do you see the list of references? Has it come up? Okay.
Yes.
So I need to talk to Dorothy about how I get this PowerPoint to you, but the American Speech and Language and Hearing Association have done incredible work in terms of interprofessional education, and I have a link there. They also have the link for the Interprofessional Education Collaboration Core Competencies Group. And do I have, you could just search this EHPIC website, and it is so phenomenal. They have research that they've gathered over many, many years. They have modules. So like if you're trying to talk about interprofessional communication, they have these great video clips of effective and ineffective communication, and it's all for fun and for free. And it's out of Canada. There's a EPIC in the United States, but the Canada reference is probably the best.
Okay.
I'm going to just type that HPIC. Yeah, just search it and it will take you to their website, and it's just a really fun website to spend time with. Dorothy, how do I get well, does anybody want the PowerPoint?
I can ask Nystra perhaps if we can convert it to PDF format and email it to the participants.
Okay. So which of do you all want it? Does anybody want it?
Or
So
I see some
perhaps-
hands.
I would be able to just put it in the chat, shouldn't I?
You might be able to attach the file if it's not too large.
Yeah, sometimes it's just, let me just see if I could just, how do you attach it on Zoom? I should know this. but
In the chat feature, I think you should be able to see a little icon of a page that says file.
Okay, there.
So click on that and it should open up on all of your documents available. So
Okay.
do you see the label of your presentation?
I got it. There it is. There it is. Do you see it?
So you're gonna
That's-
double click it and then press send so it appears in the chat.
I think it's trying to appear in the chat. It's loading.
Jan, I see we've got a hand raised. Shaelin?
Shaelin, do you want to talk?
I think she wanted the presentation. I think that was in response when you asked who was interested.
Oh, yeah, she said, okay. So it's trying to load and it's loading very slow. So maybe we'll see if it works or not. Any other questions?
I was going to say, I sent my presentation that I did on Monday night to Nystra, and they said that they would put it in the comments for my presentation. It doesn't appear there yet, but that was what I was told they were going to do, Jan. If that.
Okay. Yeah. It's it's loading very, very slowly. So I think we're kind of coming to the end of our time. Actually, we're beyond our time. God bless you all for, hopefully that wasn't offensive. Blessings to all of you for your willingness to be online from 7 to 9:30. I wasn't sure how I was going to hold up. I'm usually like tucked in reading or something by now. Yeah, it's not a big group, but a fun group. Go ahead, Marty.
Dan, your name was so familiar. I went to the U of I also, and Carol Peterson was my advisor. So now I know why your name is familiar, because I must have seen it at U of I.
Probably, when were you there?
I was there like forever, but I was in TF from like 1981 through 1984. I did like the undergrad and the graduate all together because I went back to school.
I believe I was there from 79 to 81, but I wouldn't swear by that.
Oh. So we just missed each other.
Yeah.
I was there. I
think-
was working at the Illini Union when you were in TR school, and then I went back.
There you go. Okay.
And then
What
I
a
moved
small
to-
It was
world.
it's a heyday of therapeutic recreation there. I mean, we had Peterson, Navarre,
Exactly.
Scout League Gun had just left to
And you have Stumbo too?
Dumbo.
Yes.
Norma there?
Yes, Norman.
Norma went
I
there,
think he was a student at that time,
Yes, yes.
and Conley was a student at that time.
Ted Connolly was a PhD. She
okay.
was a teacher when I was there.
Yeah, she was working on her PhD. Her and I collaborated on her research, her PhD research, and I don't know, we did some kind of collaboration. And Navarre popped in. Yeah, so there, a lot of the big dogs were there at that time. It was kind of a cool place to be.
That's so cool.
I really, I really wish I would have met Gunn because I heard she left TR to go horseback riding in the Lady Godiva kind of way at some ranch. And then she ended up being on Survivor and was one of the final candidates. I don't know if you all knew that.
Wow.
That's funny.
Oh my goodness.
Yeah. I didn't see it, but I heard about it after the fact. So we have all kinds of skills. I have that original book, the Peterson.
Peterson and Gunn.
That's what I have. Still have it. I
Me
still have
too.
it. It's ancient, but I got it.
Yeah.
We used to call it the Bible. They used to call
Yes,
the
it
Bible.
is. It's my TR Bible.
Yeah, I grew
Little
up on the
brown
Bible,
Bible.
people.
Yep.
So my presentation is still loading and it's only like a third of the way. So Dorothy, we need to figure out a better way of getting this out to people. Or why don't, the easiest way probably is if you all email me with your email address.
Yep.
Yep.
And then I could either send it as an attachment if it will fly, or if not, I could make it as a Google Doc and send it on that one.
Perfect.
So my email is monroej@ithaca.edu. And yeah, and I don't know, when we close this out, Dorothy, it's probably going to lose that connection, correct?
I believe this presentation has been recorded, so I believe the comments should be saved in prosperity. Also, speaking of which, thank you for all for being here, and thank you to Janice. If you are seeking CEUs for this session, you will receive 0.15 CEUs. There will be 2 requirements for receiving credit for attending this and any live sessions. So at the end of the session, which would be now, please comment your full name in the chat section. And also I have included a link to a Google Drive form. If you could kindly click that link and complete the attestation form, just verifying that you were here. If you have any difficulty uploading the attached form in the link, please email it to nystra2021@gmail.com.
And in terms of speakers, are you going to be sending out a note that we presented, or should we act like we were participants?
Let me find out. This is my first time moderating. I just found out a few like yesterday that I was doing this, so I will find out the answer for you.
Okay. I appreciate that. So I know it's late. Again, I want to thank you all. Hopefully you got some good information. I always enjoy doing these workshops. I wish it would have been live, because usually I like to go and have a drink after I'm done doing the presentation. Just
to bookmakers.
There you go. That's not going to happen, but please know that if you have any questions or concerns, you could feel free to contact me. Tomorrow night, my students are going to do a presentation on telehealth, and I'm going to just give them a little bit of a promotional plug here. When COVID hit, we had to turn the Center for Life Skills into a remote kind of environment, and they really stepped up to the plate. A version of this presentation that we're doing was done at an international conference in Hämeenlinna, Finland, and the students were they were the second highest rated presentation in the whole summer school of the lectures. So
Wow.
That's amazing.
pretty pleased. And the truth is they had mostly faculty in their audience. So They've beefed it up a bit to make it more than 90 minute, more than an hour long. And yeah, if you want to learn about telehealth, they did some great work. So, and having said that, let me see if this is uploaded yet. It's not going to let me go there. Yeah, so I think we should probably close, and please email me if you want me to send a PowerPoint. I'll wait until the morning and I will send them all off at that point. Okay?
Sounds good.
Go
Thank you
out
so
and do
much.
this. I'm gonna miss this part of my life, but I guess I don't have to quit.
That's for sure. Come back to Saratoga next year.
There you go. All right. Bye-bye. Have a good night.
Thanks,
too.
Sam.